Hello guys, how are you guys doing today? Are you doing well? I came here with another video. So welcome to my next video. This is a video. I'd like to have a lecture with me. This is a video that I'll talk about common communicable diseases. This is a topic that I just found out in my textbook. So we have common communicable diseases. We have diseases. So there's disease is illness when you feel sick. So we have so many names of diseases of sickness. Common communicable diseases is our topic today. You can be asked what is the common communicable diseases. So I would like to define this word what it is. Diseases which can easily be transmitted from one a person to another are called communicable diseases. Communicable diseases are also known as infectious diseases. We have so many examples of them. No, we have only four. So in my textbook it says 4 examples. So we have tuberculosis, malaria, then we have common cold, then we have typhoid. But in this case, I'd like to talk about tuberculosis, malaria. What else? So only 2 diseases we'll talk about as a note. But 4 of them are just only the examples. But as a note, we'll talk about them. Now the first one is tuberculosis. What is it caused? Is it caused by fungi or viruses or bacteria? So it is caused by bacteria as well. Tuberculosis is spread from an infected person to an uninfected person by inhaling germs coughed by infected people in air, body contact with infected people, cows to human through milk if infected, living in crowded room with infected person. Okay, this is how it's spreaded. I just mentioning. So we have the signs and symptoms. So these word signs and symptoms. So if you're told sign is what we can see and symptom what you feel. So we have signs and symptoms. These are the signs and symptoms. So we have some others. Okay, now we have persistent cough. Then we have persistent cough. Then we have weight loss, coughing of blood, fever, difficulty in breathing, change in skin complexion. Then we have loss of appetite, sweating at night, chest pain. I never got that disease, but when I have a stomach ache, I feel like I feel like not having appetite. So it's like I'm losing my appetite. So I feel like not eating food. I feel so weak. It happened to me. So it's like you're in the bed for the whole day, for the whole time. You're just sitting in the bed, you can't stand. Then we have diarrheas, you'll vomit. So that's what happened to me. For example, yesterday, I felt like vomiting. I had diarrhea. Even today, I had diarrhea. But overall, I got better now. I'm satisfied with that. We have how can you prevent from it? Immunization and vaccination are very important. For some diseases, it's very important if you are vaccinated. For vaccines, yes. If you are told injection, you feel like you feel like you're scared. Yes, I can just say like scared, but if it's a medicine, you have to use. If the doctor says you need a medicine and you need to be injected. Yeah, it's very important. If you need syringe, everyone will have a syringe as well, because it's a medicine for you. It will cure you as well. It will collect the blood. So it's very important. If you feel like it will hurt, yes, it will hurt. Of course, it will hurt, yes, but just know that it will help you. So the doctor just says this is an injection for you. You need, for example, if you feel like if you have stomach ache, of course they will tell you wait for the go to the injection room, yes, and take your syringe. They'll say that. Yes, it's very important. um then we have eat well balanced diet, live in well ventilated house, and sleep and treated net as well. Observe cleanliness, cover the mouth when coughing. Yes, when you cough, you have to cover your mouth. Just for example, this achoo, you have to cover it, because if you don't, if that's so, maybe another guy is next to you. It will affect him. So that's why you have to cover your mouth, or you can use handkerchief. You can then say achoo, for example. Yeah. Then we have malaria is caused by malaria is caused by malarial parasite called plasmodium. Okay, it is spread by the female I know by female, for example, mosquitoes biting infected person, then biting an infected person leads to transmission of malarial parasite. Then we have signs and symptoms. So there are so many others. So we have high fever, sweating, loss of appetite, vomiting, diarrhea, feeling dizzy. So we have pain in joints and back, lack of enough blood may cause anemia. Then we have vomiting. So we have we have so many others. So I'd like to end up here. Then we have preventions. Preventions I want to mention a lot, but I'll mention a little bit of it. So we have draining stagnant water, sleeping under treated mosquito nets, then clearing bushes around our house. That's all for today in this video, and make sure you subscribe and watch it. So that's all for today. If you have any questions, maybe you can comment it down below. So yeah, okay, I might answer. So I'd like to end up here.